Hi, welcome to Bone and Soft Tissue Neoplasms at bstneoplasms.com. This is the 52nd case, the dorsal clue. I put this up more than a month ago and I just hadn't had the time to put up the answer, but here it is. This is a 30-year-old who presented with pain in the dorsal lumbar region. This was what was put up. So, two sagittal MRs. Clearly, we can see this abnormal soft tissue here. It's lifting the aorta. In the contrast study, erosion and scalloping of the vertebral body here. And the question was, what is the likely diagnosis? And we had these four differentials that I had put up. What we do see is lobulated perivertebral soft tissue. It's on both sides here. It is lifting the aorta without encasing or rather pushing it anteriorly, and there is some underlying vertebral involvement, and there is significant activity on the PET-CT study. The answers were spread out as often happens with such cases, less for TB, but lymphoma was considered the most likely. Now, TB typically shouldn't have been answered at all because you would get perivertebral collections. They'd be T2 bright here. And this patient has multifocal involvement, but you may just have a single, uh, two vertebral bodies and the disc, so a single location involvement. And you could get TB without a definite collection, but then I wouldn't put it up as a quiz. So that in this particular patient is unlikely to be tuberculosis. Lymphoma can pretty much look the same as well. So here you see this abnormal soft tissue. It's encasing and displacing the aorta anteriorly, but there are associated lymph nodes as pleural effusion, etc. And you can see this abnormal tissue perivertebral on both sides of the vertebral body. Mediastinal fibrosis is very different. It will encase narrow vessels. This particular patient has encasement and narrowing of the SVC, and the lesion is a little hyperdense on the plain scan. This is a patient with Erdheim-Chester who has periaortic involvement, and that's just encasement of the aorta, and that's very different. So that really leaves us with lymphoma and IgG4 disease. And I this is the paper that had stuck in my head. I think came out in 2000 and okay, the year's not mentioned here. I think it was 2013 or 19. I'm not sure. And they talked about different forms of IgG4 disease. And what stuck in my head was perivertebral soft tissue, mid and lower dorsal region. These are the things that we have in our head that allow us to make these gestalt diagnoses. So you put them in your head and kind of try and remember that. And so I remember that any form of perivertebral soft tissue without other findings in the body, mid and lower dorsal spine, and they had these three forms. You had the band-like, the mixed, and the nodular. The nodular is really just posterior intercostal lymph nodes, and we're seeing and starting to identify them in patients who have chronic tuberculosis as well. So our patient has more, it is band-like, but it's saddle-shaped, right? It's on both sides here. Um, and it could still be either lymphoma or IgG4 disease. But the fact is, you have to then consider the possibility of IgG4, biopsied it, and I told the pathologist and the referring doctor that my first diagnosis would be IgG4. They looked for and found IgG4 disease in the histopath, and the serum IgG4 was markedly elevated. There was another paper about 5 years ago that went into all of this in even more detail. And so they had this saddle shaped appearance where there's often encasement of the intercostal arteries. Then you have the irregular infiltrative mass, you have the nodular pathology, and then there could be mixed ones. So we would call our case, I guess, a saddle shaped with an irregular infiltrative pathology. Why the mid and lower dorsal region, we don't know, and I think it may be because of spread of these cells along the lymphatic duct or the azygous vein. I've had one other patient proven to be IgG4 because of systemic disease. So uh, I don't have all the details, but the patient was proven IgG4. And again, we see this irregular infiltrative mass like lesion on March 20. The patient then had a lung lesion and then relapsed with the perivertebral lesion again. So it was a complicated case but proven. So the learning is that in patients with mid and lower dorsal perivertebral disease, right more than left, consider the likelihood of IgG4 disease. Don't forget the table of contents. We're now 52 cases strong. That's my WhatsApp channel. And remember, I've started this case of the day. As of today, we're 17 cases strong, and there are some bone and soft tissue cases here as well. This was my last CT chest review, which was last week. This was the gallbladder mass biopsy, and I spoke about running and the unfounded perceived dangers of running. You know where to comment, email, subscribe, etc. Thank you so much for listening to this. Thank you.